according to a new study, researchers say that the concept of beauty sleep is not just a myth. Getting enough shut-eye each night does actually affect your appearance. Here to talk more about the importance of sleep and how it can actually change your beauty is Assistant Clinical Professor of Dermatology at Mount Sinai, Dr. Eric Schweiger. Dr. Schweiger, nice to have you here. Welcome.
Thank you.
So this study is interesting. They basically did a study of 23 people. Some of them had a good night's sleep, some of them not so much, and they rated the attractiveness of these people, and the sleep turned out to be an important factor in how the folks look. Tell us about that.
Yeah, so in the study, there was actually 23 participants, and they did two sets of photos, one after a full night's rest and one after only 5 hours of sleep, followed by 31 hours of sleep deprivation. And then they had 65 independent reviewers rate the photographs as far as attractiveness, healthiness, and tiredness. And after they rated the photographs, not surprisingly, the people who were sleep deprived were rated as less attractive. And this was the first time it's been shown scientifically to affect your attractiveness.
I mean, it's sort of, we've all talked about this over the years, beauty sleep. And I think we all feel better, of course, after a good night's sleep and feel like we look better. But medically, what's really behind it? Why does someone look better after getting more sleep than they do after maybe only getting a few hours?
Sure. So we've known for years that lack of sleep is harmful to your overall health. And it causes high blood pressure, associated with diabetes, with obesity. But this is the first time it's been shown to affect your beauty, your skin. And there's a few scientific reasons why that makes sense. First off, when you sleep, it stimulates growth hormone, which is important for tissue regeneration and repair. In addition, healthy sleep boosts the immune system, which can reduce oxidative damage. And finally, lack of sleep can actually increase cortisol levels, and increased cortisol levels may inhibit collagen production, which can lead to wrinkles.
Very interesting. And when we talk about sleep, I mean, how much sleep are we talking about here? It can be different for each person, but is there a guideline in terms of how much sleep people really need on a nightly basis?
Yeah. Well, within our 24-hour society now, people are getting less and less sleep. Normal guidelines for sleep are probably 6 to 9 hours, with optimal sleep being different for each person. Right now, healthy adults are recommended to get 7 to 8 hours of sleep. And in the study, less than 5 hours was considered sleep deprived. So you want to get enough sleep where you feel rested the next day.
Now, what if you can't get the sleep? You had a missed night's sleep, a late night of work, or maybe you've got a new baby that's keeping you up all night. Are there things you can do, sort of quick fixes, to help your body do some of the things that it couldn't do because of the lack of sleep?
Sure. So there are a few tips that dermatologists can suggest, which will give you a boost if you happen to miss some sleep the night before. The first thing is simple. I just recommend splashing your face with cold water. This actually can constrict blood vessels on the face and decrease puffiness, and also give the skin a more smooth appearance. The second thing is to hydrate your skin. A good barrier hydrating cream can restore the barrier that gets disrupted from from lack of normal sleep. And finally, often patients who don't get enough sleep complain of uneven skin tone, so a tinted moisturizer can benefit both male and female patients.
Okay, so they're not a substitute, but they can sort of help you.
Right, they're kind of temporary measures that aren't a substitute for getting enough sleep.
Exactly. There's short-term lack of sleep, maybe 1 or 2 bad nights, and then there's longer-term issues. If you're going weeks or months or even years without getting good night's sleep, is there a long-term build-up effect of that if you're going long stages without getting good sleep?
No, we haven't studied it, but anecdotally, I do have patients who are chronically getting poor sleep, and they do appear more aged than their peers and more weathered. So, it's not been studied and proven, but we do see that to be true.
And when it comes to sleep, there's sleep and there's sleep. I mean, you can get 8 hours of solid sleep without ever waking up, or you can get a couple hours here, a couple hours there, maybe a mid-afternoon nap. Is there a difference in terms of the quality of sleep and the impact that it has on your appearance?
We think so. Deep sleep is required to stimulate the growth hormone release that kind of helps rebuild the body and rebuild the skin. So getting an hour here and tossing and turning probably isn't as good as getting a full night of sound sleep.
And I'm sure you have a lot of patients coming to you who are new parents. I went through this. We've got a 2-year-old, and that can be a year without sleep. Any recommendations for people when they're going through that new child period, which is almost always going to have disrupted sleep, in terms of what they can do to get past that issue and help make their appearance better?
Sure. Well, one thing that we recommend parents do is take turns staying up with the child, so they don't get a long-term effects of chronically missing sleep. So they can take turns, they can get hints of a good night's sleep. Besides that, there's some evidence that napping might be beneficial if you can do it. Napping is a little bit controversial in sleep because it has been shown in studies to help the cognition, help with your memory, but it hasn't been shown to have other long-term benefits that deep sleep can get you. But surely if you're not getting any sleep at night, a nap is going to be better than no sleep at all.
It's better than nothing, absolutely. All right, so get your beauty sleep. That's the bottom line. It actually works. Yep. Thank you, doctor.
Great,
appreciate it. Thanks for coming in. And for more information on this topic and other health topics, you can always log on to the health page at abcnews.com for all your latest health news.